This video will show you how to manage the insurance companies that you bill to through the healthcare assistant software located in your library. You can access the list by clicking on Library, selecting Insurance Carriers. The insurance list consists of the different insurance companies that you'll be billing to. To add a new carrier, select the New button. You can have the software either auto-assign a number for you, or you can manually enter one of your own. Before filling out the new insurance carrier form, it is required that you read the billing manual or companion guide that is associated with that insurance carrier that you're entering into the software. First, you would start by filling out the name and address of the insurance company and assigning a category to it. You could either put self-pay, workers' comp, Medicare, Medicaid, commercial insurance, Blue Cross Blue Shield, and many others to choose from. You would then select the type of insurance, whether it's a PPO, HMO, or in this case it would be not applicable. Make sure that the insurance that you're entering in is active, and also select the type of form that the claim should be printed on. Select the order in which services are to be printed on the claim, and you can also choose to print the services description on the claim form. For example, if you have an item that says SN Visit, it would say SN Visit on the claim form. The options for printing alternate codes refer to different areas of the software. When you're doing billing, there may be some certain HCPCS code or procedure codes that are required for that particular insurance company. This is where you would select from that list. Now remember that the list is actually set up in your agency setup, and the actual HCPCS code itself is actually set up in the chart of accounts, which we'll be going over later. Now when entering in an agency ID for claims, you would select which agency ID you would like to use, whether it's your MPI number, your Medicare provider number, Medicaid provider number, or depending on what the insurance company requires. The same thing goes for your agency ID for their plan of care and also your supplemental. Just select which one you would like reflected, whether it be your MPI, your Medicare ID, Medicaid ID, or any other intermediaries that you had set up in your agency setup. You would then indicate if the insurance requires a TAR, or treatment authorization request, if they require OASIS, a plan of treatment, if they are billing under the PPS or prospective payment system, and if they are billing under the prospective payment system, would they like you to include the first billable visit for your wrap in the claim? Would they like you to use the claim OASIS matching key, which is automatically generated by the OASIS, as the TAR number or treatment authorization request number? And one of the options that we added in the beginning of 2008 was to use the new PPS payment method. Now if bill under PPS is selected, use billing units is automatically selected, which is why it's grayed out and you're unable to modify it. The contact information section is for any contact person you have at that insurance company in regards to any questions or concerns to any claims or any coverage for that particular insurance. The bottom right indicates whether or not you are billing to them electronically. Now if you're billing to this insurance company electronically, you will be assigned a payer ID, the name in which to submit to, and you would select which electronic receiver setup you would like to use to submit to in the healthcare assistant software, which is set up under your electronic receiver setup under administration. If you're not billing to them electronically, you may leave this area blank. Now click Save to save the insurance company into your software.